Hello, everybody. Good afternoon, good evening. This is Dr. Shiraz Farooq, board certified colorectal surgeon, and Sydney Farooq, my spouse.
Hello.
Hi, everybody.
How's it going this evening, afternoon, morning, wherever you may be?
We are
in Tampa. It's 7 p.m. here.
And we are at the DaBootyDoc Talk at Colwell, America.
That's right.
And we wanted to welcome all of you guys who are coming here to join us and hear us out. Hopefully, you guys will get something out of this.
Wake up.
A lot of things out of
Doesn't he
it.
seem sleepy? Okay, let me take over. If you haven't joined us before, we're here tonight. We're talking about something interesting.
Elvis the pelvis.
Oh, good one. Whipping out the jokes already.
Of course.
If this is the first time you've joined our talk show, it's the DaBootyDoc Talk with Dr. Shiraz Farooq and Sydney Farooq. I'm the wife. And what we're doing is kind of opening up conversation and discussion, a little bit of education, a little bit of humor about colorectal things that you might not normally want to talk about.
Correct, guys. We are here to entertain you a little bit, and we'll mix in some jokes with some educational material. The DaBootyDoc Talk is just there for you guys to understand what the common colorectal problems are in terms of proctology and in terms of digestive health. So today's topic is not Elvis the pelvis.
But related.
We're talking about pelvic health.
Ah, interesting.
You know, and we're talking about the booty because the booty is where the pelvis is. And we're talking about a very common topic that is under discussed and pushed under the carpet, I would say.
Yeah.
And people don't talk about incontinence. Say what?
Say what?
Say what? Leaky bowels or leaky bladder. Meaning that you're leaking urine or you're leaking poop. Uh-oh. Yeah. So if you do the do-do,
okay,
or the da-da, then you should be talking to us about it. Because we're talking about the pee-pee and the poo-poo.
Writing a song for you after this, so stay tuned.
Pee-pee-pee, poo-poo-poo.
Obviously, we're on the same wavelength. So, but if you haven't talked with someone about this before, let me tell you, it will open up a lot of like-minded conversations because that's been my experience discussing incontinence with family and friends and our patients. Is you realize more and more that everyone's affected a little bit, or maybe they have incontinence they're not aware of because they don't know what the symptoms are.
Yes, basically, a lot of people. Millions of people all over the world and in America suffer from urinary incontinence, which is where you accidentally or inadvertently may leak urine. And that is very common in women as they get older, and sometimes men can also have that. And also accidental bowel leakage, or ABL, or fecal incontinence. So we are here to talk about these sensitive issues. You know why they are so sensitive?
Because they make a mess.
And they smell.
Ooh.
Oh yeah, and people are very embarrassed about it. Right. Because these are personal hygiene issues that when you become an adult and you don't wear diapers, then you forget about this issue. And this issue becomes more prevalent when you get older and you have to wear diapers again.
Right. But then you find out sometimes there's women out there after childbirth that are wearing diapers or pads.
Pads and diapers. And you know, it becomes a big issue.
Or what are some other causes of incontinence?
So incontinence, as I mentioned, could be due to aging. I mean, as you age, your bladder muscles, your bowel muscles, the pelvic floor muscles are weakening. So that's one thing that can happen. As you mentioned, childbearing females and women who undergo pregnancy, they have to pass a giant baby sometimes through the birth canal. Well, a baby through the birth canal, which is kind of bigger than usual. Yeah. So from the circumference, and that changes the anatomy. Sometimes that can cause damage to the muscles and the ligaments of the pelvis.
Or there's a surgery involved that
can do that if you've had a uterine surgery or a colon surgery or some pelvic operation. Sometimes diseases can cause urinary and fecal incontinence if they involve your nerves, like diabetes or some neuropathic problems or neurologic disorders. Sometimes accidents and traumas. If you've had a spinal injury in a road accident or a fall, that can affect your nerves to the back. It can definitely affect your urinary incontinence or your bowel incontinence. So those are issues that become
What
obvious.
about prolapse?
Oh, sometimes excessive diarrhea or constipation in patients can do that. Sometimes rectal prolapse or uh, bladder prolapse can happen if the muscles are weak. So weakness of the muscles is another thing. So when I said diarrhea and constipation, if patients have to push a lot and strain to get the pee out or the poop out, that can become a problem. Sometimes patients who have kidney stones have problems urinating, so they have difficulty passing urine, and that can be a problem. So those are issues that we bring up, and we thought that it would be nice to talk about them today.
Well, because you're not alone, and it doesn't matter if you're 80 years old and wearing a diaper or 40 years old and wearing a pad. It's a problem. It's a major problem, and one of the biggest effects is on your quality of life.
Correct.
So,
Our elderly grandpas and grandmas are not able to leave the homes. They're embarrassed. It could be even younger people. Okay, guys, if you are leaking urine and poop, number one, you're going to stink and smell. It'll be unhygienic and unsanitary. So you will try to avoid human contact. Don't touch me.
but
So-
these
so
are
it's a
stigmas too. I
Stigmas,
mean,
yes.
like, do we treat our patients that smell bad differently? No, because we understand what's going on. But people, unless you're talking about it or knowing about it, then you don't understand, like, what's that old person smell?
Yes,
Well-
the grandma's musky smell that you have is probably because she's incontinent to urine and stool. And
So-
the grandma's not coming out of her home because she's feeling embarrassed and not able to visit the grandchildren. And that's a tragedy. Okay, so we are here to talk about that and hopefully bring some knowledge and some education to our
But
to our
even
peeps.
some of the other examples from like younger people, any kind of high impact sports or play can cause urinary incontinence in like young mothers or for men who have had surgeries.
Correct, prostate surgery, have cancer. So those patients can also have issues.
Right.
So we thought that we'll bring this up and go over some of that stuff.
Yeah. So other than what causes it and the effect it has, which is on your quality
Down a lot, so it's a good
There's-
idea to be
there's
proactive
treatment
about it.
options, right?
Yes, that's why we're here, because we are here to fix the problem.
Fix the smell. So don't worry. There are treatment options. Some of them are simple. There's non-invasive treatment options, but there's surgical options too. So we want to talk about both of those. So what's the first thing? We're not gonna go do a prolapse surgery, right?
No, the first thing you have to do is exercise plays a big role. So guys, pelvic floor and pelvic health is important because this is a muscle that is holding your body, holding your bowels and everything inside. And the muscle goes from both parts of the hip bones that you can feel on each side. And it goes in the middle and meets, and it basically holds up everything.
Right.
And if this muscle
And there's
is
a
weak,
lot weighing on that, right?
Yes. If you cough, if you have COPD or you're a chronic smoker, or you have some other airway problem and you have to push a lot, the Valsalva maneuver will cause your uterus and your vagina and your rectum to fall out. And those defects and those muscles can get weak with age, with lack of hormones.
And when
other
he
things.
says fall out, he means prolapsing. So you're not gonna stand up one day and lose your bottoms.
Well, it can
But-
happen. You can lose your bottoms.
But you can have very severe prolapse where
You may
that's
require
technically,
surgery. Yes.
what's happening is, so strengthening exercises
Are very important. We call them Kegel exercises, guys.
or Kegel, maybe you've heard. I don't know the
Kegel.
pronunciation.
Kegel, Kegel exercises, which is basically a very simple exercise when somebody is going to urinate. It's the same muscles that are involved when you are trying to hold your pee. So say you're in a bathroom and you're trying to go and you relax and the urine comes out. Same thing with the stool. If you're trying to hold it, then you're trying to command your pelvic muscles to contract. And if you can sitting down, you can contract them and squeeze them and relax them. That exercise is called Kegel exercise.
So squeeze.
Squeeze, yes. So then the other things that you have to know and do are dietary changes, add more fiber, eat better food, avoid alcohol, avoid caffeine, avoid nicotine. All these things can cause irritation of the bladder and bowels.
Your treatment plan is going to depend. So we're kind of mixing the two, urinary and fecal incontinence.
Correct.
But, you know, for example, if you have urinary incontinence, then things like caffeine can stimulate it, make you have less control of your bladder.
And actually, nicotine is an irritant to the bladder, so smoking is a big no-no. Alcohol also is irritating to the bowel and bladder.
Whereas like fecal incontinence, you might increase your fiber intake. That's going to help that more.
Correct. And lack of fiber will mean you're constipated.
Mm-hmm.
And if you're constipated, you have to push more. And your muscles will get weaker like that.
Right.
So those things will help. If these are not helping,
what about hydration?
Hydration is very important.
I know we always throw that in.
Yes,
it's number
we are
one,
all cucumbers.
Right,
drink lots of fluids, guys. So if these don't work, then you'll seek medical advice and get medicines. There are some medicines that can make the bladder contract. There are some medicines that can
like a pill or like a shot,
like a pill, like an injection. There are also medications to slow the intestines down, so you don't have diarrhea or liquid bowel all the time. So you can kind of slow the intestines and make you clamp and not go as many times. So medical therapy is there, and then there are surgical options. Okay, surgical options may range from a sling that you can use to hold the bladder up. Sometimes you have artificial sphincters. In the same way, the anal sphincter may be damaged from childbirth or trauma, so you can repair that.
Is sacral nerve modulation a non-invasive therapy or is it surgical?
It's a surgical option, but it's a minimally invasive surgical option. Glad that you mentioned it, basically.
That's what I was thinking of.
So it's basically the stimulation of the nerves of the pelvis with electrical current. So I like to think of that as a pacemaker or for the pelvis area, and that provides electrical current which shocks the pelvis. That shocking sensation you have makes Elvis do the pelvis dance. Okay, so what happens is that the electrical activity of the nerves is simulated by giving them electrical activity from a battery. The battery goes under your skin in the back above the buttock area, and it stays in there permanently or semi-permanently. For 5 to 15 years it can stay there. And that goes inside your nerves with a small tiny wire, and that wire gives electrical current like the TENS unit. You know, a lot of people know about the TENS unit. So this is electrical TENS-like activity for the pelvic floor. And that causes the muscle to contract.
Is it something you can regulate, or the patient just has the implant?
The patient can increase the frequency electricity or can decrease it. Yes, so that can happen. Also, if that doesn't work, then there are major operations. Sometimes for bowel incontinence is so severe and patients are leaking all the time that nothing works. In those patients, you have to do a colostomy, where you have to bring a loop of intestine out, and that becomes your abdominal anus.
So you basically resection your internal intestines to have an external bag. And so you're not using your sphincter or your anus anymore. You're just, once you eat, it's going to come out into the bag.
Into the bag, which for some people is okay, but you know, it
might be a better option.
But it depends on the condition and how you deal with it. So fecal incontinence is obviously a big deal. So we want to mitigate any patient who has to go through that colostomy process.
Or a prolapse surgery. That's a pretty severe surgery too.
Yes. So those operations can help and improve some patients with fecal incontinence or urinary incontinence. So urinary incontinence also gets better with pelvic floor therapy. sacral nerve implantation. And obviously there are urologic procedures to help with that, including improving the sling. You can put a mesh in there to buffer the area, and other surgeries. And urologic experts can talk about that more.
Oh yeah, true. Mesh can help.
Yes, yes.
Interesting. So if you do have to have a surgical option, then what types of surgeries are you doing?
Oh, you can also do laparoscopic or robotic surgery for that. So you can do abdominal surgery, pelvic surgery, or surgery from the bottom. So there are different varieties of surgeries that can be done either together or separately or one after the other.
Now, I have seen improvements in technology, like the sacral nerve modulation.
So sacral nerve modulation is a fantastic new technology that is out there. I also want to talk about Kegel exercises. Kegel exercises are very important, and now we have machines that can help you with Kegel exercises. You have some machines that have simulators that you can insert inside the vagina or the anus or the rectum, and they can give you electrical activity like that.
Mm-hmm.
But the problem is that nobody wants to shove something up their butt and have a treatment like that. It can be cumbersome.
It's non-invasive, but it's a little bit invasive.
It is invasive in the sense that you're invading into a body cavity, but you're not cutting anything open.
Now,
So
these treatments aren't necessarily painful, or it's not surgical.
but they will help to simulate and stimulate the muscles and make the muscle grow. Right. There's another technology called the Amsella chair or the Kegel chair that is out there, and that is a new technology that where you have electromagnetic energy beaming as you sit on the chair, and it causes simulation of the muscle and contraction. So that causes the muscles to grow, and that can improve incontinence of urine, and maybe fecal incontinence can also get better. That is being studied at this time also.
Right.
So we have, apart from that, we have different diagnostic testing also. New MRI machines have come out, and new imaging studies have come out.
So you can see where the problem is.
Yeah. So,
like, for example, probably people that have urinary incontinence might not know about it, but they notice their fecal incontinence, and then they learn they have both.
Or vice versa. Yeah. So you have a urodynamic testing that is out there where you can find out how the patient is urinating or voiding, and you can find the problem, and then maybe with medicines, physical therapy, or with surgery, or a combination, sometimes you can get the patients better.
Or maybe your issue is due to a medical condition. So maybe you have a fissure that you don't know about, or something.
Or you're incontinent because you have severe diabetes, and that's caused severe nerve damage to the nerves in that area. So controlling blood sugar and optimizing your health is important. Elderly patients, if they are not active, will have muscle loss all over their body. So they'll also lose muscle in the pelvic floor. So for those patients, pelvic floor exercises is a big deal. That can help also.
I think that anyone with incontinence, whether it's urinary incontinence or fecal incontinence, that's going to be the number one thing that your urologist or colorectal surgeon is going to tell you is Kegel exercises and exercising the pelvic floor.
Yeah, and I tell people the example is like if you have a dumbbell and if you're lifting the dumbbell every day, that arm is going to become bigger and bigger like Popeyes. Okay, you may eat all the spinach, but unless you're using dumbbells and exercising, that may not happen.
So you need to change your lifestyle.
So lifestyle is very important, guys. Physical activity, not using alcohol, minimizing nicotine and caffeine and other irritants will allow your bladder and your bowels to function better. So those are things. Hydration is important. And I think if people do these things, they will really improve. A lot of our elderly population doesn't know about Kegel exercises, doesn't know how to do them. There's a lot of help that we can give them.
Well, and that's what I hear all the time too, is like, well, what's the right way to do it? What's the wrong way to do it? Is there a better way? Do there's no preference, but do something that will help better than nothing.
So another thing that is important for the pelvic floor is the core. Okay, and the core is your body here. Okay, that means your back your front and your back. So you have muscles in the front and you have muscles in the back. If these muscles are powerful and they are taut and tight, what that'll happen is it'll keep you a good posture. You're not going to slouch like that.
Yeah.
And with this posture, the pelvic floor muscles are going to work together.
Right.
So it is important to have a good abdominal, if not a 6-pack or not an 8-pack, maybe a 2-pack.
Well,
or
also,
something,
16-pack. Also, think about it. If you are maybe in this elderly population dealing with incontinence, and if you don't have good core strength, you're going to be less mobile, less active. That's going to contribute to the weakness of your pelvic floor too, because you're not getting out there doing things, giving yourself the ability to regain your strength.
And a weak pelvic floor and a weak body and core also makes you more vulnerable to falls. Okay, guys, hip fractures in elderly patients are the #1 cause of death in the elderly population. Okay, one of them. And a lot of them, when they get sick and they fall down, are bedridden. And then when they're bedridden, their muscles get weaker. And when they get weaker, their incontinence gets worse. So then they're leaking, pooping into their pants, wet, and they get sick, and then they can get ulcers, and they can get infected, and then they can have other problems like blood clots, heart attacks, pneumonias, so arthritis. So all of those things can be prevented by Kegel exercising your core, improving your diet, and moving a little bit. So if you don't move it, you lose it. Yes.
You lose your pelvic floor muscles. These are serious issues though, and with kind of simple solutions. So there's a lot of moderate to low levels of incontinence in the population.
Correct.
And then there's severe too. So these people that are in that lower category are going to be the people that can't hold it when they're 80 years old.
Aha, that's a very good point.
Okay, so you need to
this is very important.
Use interventions now. Look into the research. What's new out there? What's non-invasive? How can your dribble turn into nothing? Whereas down the road, you can't even go outside, hang out with your friends. You're 60 years old, you want to drink with your boys on the weekends still, but you're pooping your pants or peeing yourself.
So peeing and pooping are a big no-no because it's socially embarrassing, it's personally unhygienic. So we are here to change that with an education, with educational stuff about pelvic health. So I think Elvis the Pelvis was right. Okay, you have to shake your booty. Okay, when you shake your booty, what happens is that you're engaging the core muscles and the pelvic floor muscles.
Right.
So dance is a very good way to increase pelvic floor health.
I second that.
Yes.
Also, well, I want to say more about what I was talking about.
Yes.
And then I have something else to say. But I wanted you to say more about what I was going to say actually, because we were talking about intervention. So the time is now.
The time is now, guys. If you're younger and you just had a baby and your pelvic floor just went through this severe issue where your muscles are weak, don't wait for years to go by and then you get weaker muscles. Start working on those pelvic muscles. All these moms that are out there with newborns and young babies, please start going to the gym, start losing that weight, start exercising your pelvic core, your pelvic floor and your core. So you should start doing some squats, some abdominal, lifts and other things that you can do.
And there's courses on pelvic floor therapies. You could do some research, find out what treatments are out there. We talked about non-invasive, non-surgical treatments versus surgical options. So a lot of people aren't going to even be in that surgical category. There's a lot of exercise and work you can do to improve your pelvic floor.
And I want to also bring this up. Operations on the muscle generally don't work very well. Okay, muscle is one of the organs in the body that only heals by scarring. Other organs, bone can heal, liver can heal, skin can heal.
So we want this to be your last stop. Like
So
if you have to get
muscles don't
surgery
heal.
down there.
Muscles heal by scarring. So when muscles heal and they are causing scar in that area, the muscle strength is not the same.
Right.
So injury to the muscle is a big deal. Improving the muscle tone and the bulk of the muscle will help you improve your life. So go out to the gym, go work out, go run around, eat better food. Fiber is very important. Okay, here comes the fiber part, guys. Ta-da-da-da.
Fiber force.
Fiber is so important for you because when you eat plant-based fiber and you're eating both soluble and insoluble fiber, your digestive system moves everything through very cleanly. When it does, you don't get constipation. You don't have to force it out. That force is going to, that constipation or excessive diarrhea, if you have that, is going to cause your muscles to get weaker.
And if you're sitting on the toilet, putting that extra weight on your anus and your rectum, that's a lot of pelvic stress too.
Yeah, so the stress on the pelvis. So
Don't pull
sit.
weeds every day.
Yeah, and don't
Squat.
sit too long.
And also, I was gonna say, shout out to men out there who don't like to talk about their problems as much, especially when it involves their, little.
Well,
special diet.
erectile dysfunction and urinary incontinence in males is very common after a certain age, and hormonal issues play into that, and as well as weakness of the muscles and age. So we have to be
get
proactive.
it looked at. Find out. It might be a simple fix. You might think you have this major problem. You don't want to tell your friends. You don't want to tell your doctor because she's a lady. Whatever. You need to discuss it because there might be something like doing Kegels for a
Both
man.
men and women.
That's going to improve your blood flow in the area. It's going to improve your erection. There might be medications, just something simple. So seek help. And that's just the last thing I want to talk about. Okay?
Yes. So
No,
so
I mean after that. It's
okay. You have.
one more thing, yeah. But whatever you have to say, I want.
So I want you to. I want you to say that.
I was going to add something. That
Okay.
also, if you're improving your pelvic floor, you're going to have this inadvertent effect of better sexual health too.
Correct.
So this is something other people don't want to talk about as well, because it's a taboo topic, but it's a great topic.
Pelvic health means improved sexual healing, and sexual health is important for every human being.
Right.
Because when you're active and alive, you feel like you have vigor. You're going to be moving around and doing stuff.
Right.
So it's very important.
So keep that in mind too, that, your quality of life is low if you're peeing and pooping unexpectedly, but also then you lose that whole aspect of your life where you have that sexual energy and
the sexual drive is not there. So then your engine your motor doesn't,
so keep that in mind too, that if you're helping with your incontinence, you're going to be helping with other quality of life aspects too.
The Hindus and the ancients have been talking about the sacral chakra, and the sacral chakra is exactly that. It's the muscles in that area, and it's the lymphatic system, it's the blood flow in that area. It's that source of energy that is there that keeps us vibrant, and that's the motor that keeps everything going.
Right.
So from the bottom to the top, if the bottom's not working, you got problems. So we got solutions. Solutions are work at it. Do some Kegels, do some pelvic floor exercise, guys.
Your pelvic floor. I want everyone to go home and research pelvic floor exercises, pelvic floor therapy, pelvic floor health. You'll see what the benefits are, and it's not just going to be because you're having some incontinence. There might be other effects too.
Correct. I'm very happy that we brought this topic on board. A lot of colorectal surgeons and proctologists deal with this. A lot of other doctors deal with this, and I think the audience and the general population needs to know about it.
Definitely.
And this is very helpful. Any last words, Sydney?
I already said too much.
Okay.
But if you want more, come talk to us on our social media. You can even call our office. We're here. So if you have questions, if you want to be involved in our show, if you want to hear about a topic, give a shout out.
Thank you, guys. We are here in Tampa, Florida. Dr. Shiraz Farooq, board certified colorectal surgeon, and Sydney Farooq, my spouse. We are together trying to
change the world and help
all of you. So
see us next week.
Yes, guys.
Have
Hopefully you guys have a great evening today. Take care.
Thanks.
Thank you.
Bye.
Bye-bye.